COVID-19 health event. Today we are joined by Cabinet Secretary Sir Carlos Nograles and also Secretary of Health Secretary Francisco T. Duque III and our Assistant Secretary Duque will now give his statement.
Okay, thank you very much, Dr. Meng. Good afternoon, everyone. Muli, magandang hapon sa ngalan ng Department of Health at lalong-lalo na ang Interagency Task Force on Emerging Infectious Disease and in particular COVID-19. And we are indeed blessed to be joined in by none other than our very own Cabinet Secretary, Secretary Carlo Nograles, who also chairs the Cabinet Assistance System. And the good secretary has been unanimously chosen to join as ex-officio member of the Interagency Task Force on EID. So, welcome, Secretary Carlo, to our press con. And also with us, of course, is ASEC Rosette Bergeri, who will answer your more detailed questions with regard to updates on the repatriates. The DOH and the Department of Foreign Affairs repatriated 445 Filipinos from the MV Diamond Princess cruise ship. Are currently quarantined in New Clark City or NCC, Capas Tarlac, together with the 13 repatriation team members from the DOH, 9 of them, DFA, 4 of them, bringing the total of persons under quarantine to 458. Our President Rodrigo Roa Duterte, has directed the Interagency Task Force on Emerging Infectious Diseases to take all the necessary measures to ensure the health and safe return of our kababayans aboard the cruise ship. The well-being of our fellow Filipinos, no matter where they are, is of utmost importance. DOH only allowed the repatriation of Filipinos who tested negative for the COVID-19 in Japan. The repatriates underwent 5 levels of screening for fever and respiratory signs and symptoms. First, prior to disembarking from the cruise ship. Second level, before boarding the bus to Haneda Airport. Third, during the flight. Fourth, upon landing at the Clark Air Base. And fifth, upon arrival at the quarantine facility. All of the OFs, or the overseas Filipinos, were asymptomatic throughout the flight and were transferred directly to the quarantine facility in the NCC. All quarantine individuals will be assessed twice daily, once via telemedicine and another assessment through actual physical examination. They will be provided with food, hygiene kits, and appropriate health services. An ambulance team is also on standby 24/7 to conduct hospital referrals if needed. DOH hospitals in Central Luzon are prepared to cater to those who may manifest respiratory symptoms or fever. As observed in other countries, there is still a possibility that our nationals may eventually. And we have prepared and equipped our hospitals and laboratory facilities and allocated all necessary resources and PPEs should this happen. So we are ready in case, just in case that eventuality does happen. The department is continuously monitoring the situation and will update its 14-day prescribed quarantine procedure based on evidence and new developments. We have placed measures for the appropriate isolation and management of individuals who may eventually test positive for COVID-19 to contain transmission. We are ready to address any possible scenario. Our priority is always the welfare of our kababayans. Now, on the IATF agreement on South Korea travel restriction, this agreement was arrived at during our 8th IATF on EID just this morning, lasting till early this afternoon. And the task force has resolved to impose travel restrictions for passengers from North Gyeongsang Province, South Korea, including, of course, Daegu City and Cheongdo County, effective immediately. Filipinos and their foreign spouses or children and holders of permanent resident and diplomatic visas will be allowed entry subject to existing screening and quarantine protocols. The travel restriction will be reviewed and re-evaluated within the next 48 hours based on new developments. On the other hand, any travel to South Korea will be temporarily suspended. Only permanent residents of South Korea, Filipinos leaving for study, and OFWs returning for work will be allowed, provided that they sign a written declaration acknowledging the risks involved, which will be complemented with a health advisory pamphlets. So this ends my statement, and certainly we are open to questions from our media partners and
Sir, please.
Good afternoon, sir and ma'am. Just to clarify, you said, sir, that any travel to South Korea will be temporarily suspended. So this covers Filipinos who may want to travel to any part of South Korea, like Seoul, for kahit travel purposes, hindi na po pwede pumunta.
yes, hindi na po pwede, at ito naman consistent yung ating policy with regard to China, Hong Kong, and Macau. So we are uniformly applying the same policy.
Meron po ba tayo, sir, any specific time until when this travel ban will be implemented, or like with China, still under assessment po?
Everything is always under assessment. There will be a risk assessment, and there will be other impact assessments that will be done for the next 48 hours. In fact, we will have to see what the risk assessments will be that will guide the IATF in either expanding the travel ban or keeping the status quo. So depending on what the developments are in South Korea, but suffice it to say that right now there are about 1,170 plus COVID-19 positive cases in South Korea, with 11
finish the process so that it can be delivered. Also, coming from an important source, ito pong kits na kukunin natin.
Wala ba ma'am yung info on the content?
Wala kaming information ngayon kung saan country na ito.
Some of the health workers will obviously be face-to-face with the patients under monitoring sa New Clark City. How can we ensure na hindi sila magiging carrier ng infection? Kasi I'm guessing they'll be coming home to their families as well. So the health workers will just be there. Hindi sila aalis for 14 days as well.
Yes, ma'am. The health workers are there. They are going to stay and stay with the patients and They are going to stay with the patients throughout the 14-day quarantine period. So minimal exposure, that is our objective. So this kind of situation that you're saying would be prevented.
A lot of the experts are talking about the possibility of a pandemic worldwide, and WHO is saying that the best solution would be to prepare as early as now. Ano po ba yung mga preparations natin in case it becomes declared as a pandemic? And I think ang main dun is choosing which hospitals will be caring for those severely ill. Parang gano'n. Ano po ba yung mga preparations na natin?
Actually, even before the WHO's anticipation of a pandemic means a wide geographic area where the spread of the COVID-19 is. We have been preparing long before this anticipation manifested by the WHO of a possible pandemic. And we're doing this at the different levels. At the level of incident planning and management, Number two is at the level of surveillance and risk assessment. Okay. Number three would be laboratory capacity building, and this is the reason why we've been increasing the number of our capability for surge capacity in case maraming tao magkaroon ng COVID-19, handa ang ating pagsusuri ng RITM. And then we have clinical management and hospital care, as what you have correctly pointed out. We are also leveling up capacities of our levels 2 and 3 hospitals jointly between the LGU and the national government retained DOH hospital. So we've actually given out the guidelines that will clearly show the steps that will level up all the measures, including infection control and prevention. Okay, and then let me just finish the different levels where we have leveled up. Okay, so the of course the non-pharmaceutical public health measures such as the promotion of cough etiquette, of frequent hand washing for 20 seconds, the social distancing where possible, and the measures to strengthen the individual's resistance, not just against COVID-19 but all other microbes. And then we have risk communication and community engagement, which is a very, very important component should we operate under a COVID. Points of entries, identification, saan ba pwedeng makapasok yan. So, mamantayin na natin yan, part of our surveillance. And then, of course, there's one more I'm trying to recall is operational logistics is our very important consideration in the different levels of interventions against COVID-19.
Just to
Sir JC then, mamaya ko.
Sec, in the event po na magkaroon ng positive or may pag-manifest po ng symptoms during the quarantine, ano po again yung kahandaan natin? Ano po yung protocol na gagawin sa kanila?
Nakahanda na po tayo, sir. We've mobilized about 21 hospitals within Region 3 para tulungan tayo kung dumating yung panahon, kung sakasakali na magkaroon ng tao o yung repatriate natin na magkakasimptoma, sila ay immediately nadadalhin doon sa mga hospital natin. Ang ating mga hospital ay capable na mag-manage itong patients under investigation natin, nabigyan sila ng orientation, and they are very much capable of managing this case.
At saka po, add ko lang po, there have been reports na sinasabi yung asymptomatic transmission and asymptomatic din pero positive sa virus. Thoughts on that, sir?
There has been reports about this asymptomatic individuals who has turned positive. And ito po ay masusing pinag-aaralan ngayon. Marami na po naging eksperyensya ang bawat bansa ukol dito sa mga asymptomatic individuals na to. Even here in the MB Diamond Princess, nakikita at lumabas din sa isang artikulo na marami sa kanila ang nagpositibo kahit wala silang simptomas. So pinag-aaralan po lahat yan sa ngayon, kung ano po ang mga naging kadahilanan kung bakit wala namang simptomas ay nagpositibo. Masasabi po natin yan maybe in the coming months pagkatapos po natin mabuo lahat ng datos natin.
Paano po yun, ma'am? Yung mga naka-uwi na po, yung mga nakatapos ng 14-day quarantine? Given that possibility nga po.
They were tested and showed to be negative. So wala namang problema. Na-test naman sila.
Secretary, just like to ask, paano ang protocol kapag may nakita, yun nga, the eventuality na magkaroon ng positive sa mga naka-quarantine ngayon, will they be transferred to another quarantine facility since meron ng at least interaction with the number 400 plus inside the NCC? Or papaano po yung magiging measures po ng DOH about it?
No, it's going to be symptoms-based. The protocol there is kung may lagnat, may fever, may coughs, i-isolate ka agad yun. Tandaan ninyo, as tagi-isang kwarto itong mga ito. So they will be isolated, meron po 14-day quarantine period. So yun yun.
Okay, next, Madam Jovik Tester.
So travelers from South Korea will still be allowed entry into the Philippines except for the areas that you mentioned po, sir. Tama po ba? So sir,
Maybe I can ask Secretary Carlo Nograles to respond to that.
Yeah. So just to clarify, una inbound from South Korea to the Philippines. Yung Daegu City, Cheongdo County, which all belong to North Gyeongsang Province, may travel restrictions na po. Mula sa areas na yan, pag inbound from South Korea, from that area, those areas in the Philippines, wala lang. Bawal na po talaga. Other areas in South Korea, pwede sila pumunta dito, grant some sort of protocol or some sort of certification that within the last 14 days before they travel to the Philippines, hindi sila bumisita ng North Gyeongsang province, anywhere dun sa North Gyeongsang. So very clear yung sa inbound. Sa outbound po, walang Pilipino lumalaki ng lumalaki. So we really don't know the final number. But it started with 210, but now dumami na yung mga. So maybe tomorrow we'll get a clearer assessment of the number ng mga nag-signify ng mga kapwa natin mga kababayan who want to be repatriated to the Philippines. No? I also want to emphasize na itong with the South Korea, this travel restrictions sa South Korea, we're closely monitoring it. That's why sabi nga namin, within the next 48 hours, we will be constantly reassessing the situation as it goes along.
So, yung sa South Korea, yung sa debut. Kaya one of the reasons kung bakit nagkaroon ng spike in the number of cases ay dahil it's attributed dun sa religious gathering. Bang napag-usapan sa IATF kanina on possibly suspending yung nationwide mall sale na i-host ng Department of Tourism by March 1, given na advice na din naman ng DOH na to avoid crowded places.
Well, we are constantly monitoring the situation. So we cannot give you a definite answer to that question. Let us be very clear, there is no local transmission as of today with regard to COVID-19. So you just have to wait for advisories coming from the DOH and also depending on what policies the IATF will adopt to address this particular situation as the date nears, as the event nears.
Last for question, sir, ma'am, Ma'am Sheila, then Sir Chair.
Sir, meron na bang lumabas na protocol para dun sa mga flight crew natin na papasok ng Hong Kong and Macau, given na partial pa lang yung ban on these countries?
This afternoon or early this morning also, when we had our interagency task force meeting, the guidelines for the exemption of pilots and
ano po yung protocols ng supply chain and provisions para po dun sa
kung saan ang Region 3 namin ng DOH ang nakatulong dun sa aming sa management ng MV Diamond Princess para makontrata ito. So itong mga waste natin doon are considered hazardous waste, no? So meron nakatalaga na pagtatapunan at kung paano ang proseso kung paano siya i-dispose.
just to clarify na lang din po, kung humahalo po ba yung kanilang water system, waste disposal system and sewage system sa karating lugar? Just in case. Opo.
I don't think so because this is a building na separate talaga. Hindi siya ganun kalapit doon sa community.
Next one.
Good afternoon, AC Nichols from CNET Philippines. I just wanted to ask po if napag-uusapan na sa mga meetings yung possible scenarios of maybe locking down certain areas like what they're here in the Philippines po, like what they're doing in northern Italy. I know wala pa naman pong case of local transmission, but napag-usapan lang po ba and ano po yung preparation level ng country natin if there will be a need to do that in the future?
Let's not preempt what's going to happen. We don't know. What we can say, there's no local transmission, but we have already adopted a four-door response strategy. The same level of preparations at the national level, there will be a replication of that at the local level, at the smaller scales. Okay, so this has to be very clear. And a major operating unit at the local government unit level is the Barangay Emergency Health Response Teams or systems. So yan, alam na po nila ang bawat hakbang from contact tracing in the locality, quarantine, case management, of course preceded by surveillance, and then after that you have all the things that I have enumerated, at least 8 interventions.
Sir, yung 10 na na-discharge na positive previously na crew,
and we are just awaiting advice from the DFA what has been the latest desire or plans of
given nga yung period.
given the PUIs na ngayon as a 90 plus na lang, 101 na lang, mukhang there is no indication na of the group or groups that might have been exposed to the 3 Chinese nationals, mukhang walang indication na nagkasakit sila. Kasi kung nagkasakit sila, ay dapat nakita na yan sa mga ospital natin na sila yung tumutugon sa mga bawat PUIs. And kung meron man, nakita na natin sana. No? Pero konti lang naman, yung mga ibang na contact trace, talagang na pasok bilang mga PUIs. But eventually, a lot of them got negative results and thus discharged.
Sir, may information kayo kung ilan dito?
PUIs, meron tayong Filipinos 72.5%, followed by Chinese 20%, Americans 3%, and iba pulos mga
So because highly concentrated doon, then we, the task force, felt that we can impose the temporary travel ban doon muna sa area na yun, subject na to the 48 hours na masinsinang assessment at reassessment ang gagawin natin. So in the meantime, yun lang muna because meron ng may mga assurances naman na binigay ng South Korean government that it is just clustered in that area and they're containing the event or the scare dun lang sa area na yun. So again, 48 hours na assessment at reassessment ang gagawin natin. Kung makikita natin na medyo kumalat na sa ibang lugar, then that will be another point of consideration ng task force.
Pero sir, bakit yung from the Philippines?
Yung outbound, kasi syempre, yung consistency natin na yung the same way that we treated dun sa China, Macau, and Hong Kong, na yung outbound nga ay pinagbawalan natin if it's for other purposes other than being an OFW or being a student or a permanent resident. So yun yung naging natin, point of decision natin.
Sir, may mga clarification lang. Sir, yung may
Single questions, Bomboracho din.
Kay Sec Nagales po, from Bomboracho po. Napag-usapan na po ba napag-usapan po ba sa meeting yung economic impact nung since yung first na nag-pass po tayo sa travel from China and now affected na rin yung travel to South Korea. Nakita naman po natin na yung Chinese and Korean, sila po yung parang top na mga tourists natin. Ano po yung napag-usapan ng task force? Kasi may mga reports po na yung Boracay, yung LGU po doon ng Kalibo, very concerned sila when it comes to their tourism.
Yes, so this is obviously latest development. No? When we did the numbers dun sa maging impact nito sa tourism, it was only based dun sa impact with regard to yung travel restriction. Now, I'm computing anong maging impact ito as far as tourism is concerned and we'll get back to you on the numbers soon. So, ifa-factor in na namin ito, especially when it comes to tourism, pati yung sa remittances, ifa-factor in din namin ito, if ever. But, as far as remittances is concerned, remember na hindi natin pinagbabawalan yung OFWs natin to go to South.
Scenario happen kasi sa Hong Kong daw po, because may decline sa stock sa Asia Pacific, yung permanent residents nila parang makakatanggap ng equivalent to 64,000 from their fallout.
Well, siguro if we ever give any assistance, it should be targeted, no? So, titingnan natin kung how much of the employment numbers ang maapektuhan natin dito. So, kunyari, for example, if ma-affect nga yung tourism industry natin, ano yung magiging fallout nun in terms of employment? So, meron tayong several options, no? If member naman sila sa SSS, then we need to talk to SSS about some unemployment assistance na pwede nilang gawin. Or through the Department of Labor and Employment, maaaring pwede natin tulungan sila sa paghanap ng bagong trabaho or some sort of financial assistance na maaari natin bigay when it comes to that. But right now, kung for example, ang maapektuhan lamang
air conditioning. units, but it's not very clear. There's no evidence as of the moment, no science behind it. So it is perhaps speculative to say the least. The WHO has not given any advisory with regard to shutting off the air conditioning system to lessen the chances of the COVID being transmitted and propagated. So that's a bit granular, but we'll ask WHO. And so, yung kanila, I just wanted to add to the statement of Secretary Nograles with regard to the social protection safety nets. No? For the OFWs, the OWA is the social agency that ensures that whoever is disadvantaged among the OFWs, the OWA's bounden duty is to provide temporary assistance to tide them over until after they get stabilized and perhaps are able to get new employment elsewhere.
Sir, yung second question ko po kanina, what could we be doing right kaya wala pa rin local transmission hanggang ngayon?
The Epidemiology Bureau, it has mobilized all of its surveillance officers for contact tracing that it did undertake together with the PNP and the Criminal Investigation and Detection Group, or CIDG. The laboratory capability, before we needed to send our specimens to Australia, Melbourne, for definitive testing. But now we already have the capability to detect and isolate and detect the COVID-19 using the RNA primers that have been donated by the Japanese government at the first instance, and at the second instance, the WHO had complemented supply of RNA primers, a chemical that is important to detect the presence of COVID-19 in the oropharyngeal and the nasopharyngeal swabs or specimen. And now, as was correctly pointed out, the RITM is aggressively addressing the extraction kits necessary for we do. And then, of course, the CAP etiquette the social distancing, all of these preventive measures are of extreme import, and the mitigation measures that in case there are COVID-19 cases admitted in the hospitals, and the hospitals will ensure what is known as the clinical best practice management of individual COVID cases. To mitigate, the possibility of patients dying, we'll do our best so that the death rates will not, no deaths will happen, but of course, if and when it happens, hopefully it will be minuscule or really very low ratio.
Thank you, Secretary Duque.
Siguro,
for final.
to add to what Secretary Duque just said, siguro doon yung support natin mga LGUs. Then in terms of national, not the national government level,
partners. So that concludes our regular press briefing for this day, Wednesday. We'll be updating our major partners on the next schedule. Thank you very much. Magandang hapon po.